What are colloids? Before we jump into the applications, let's quickly define what colloids are. Colloids are heterogeneous mixture where one substance of microscopically dispersed insoluble particles is suspended throughout another substance. The key characteristic is their particle size, typically ranging from 1 nanometer into 1000 nanometers. This intermediate size gives them unique properties compared to true solution, where particles are molecularly dispersed, and suspensions, where particles are much larger and tend to settle. There are three colloidal properties that are relevant to pharmacy. The first one is large surface area. Due to their small size, colloids have a very high surface area to volume ratio, which is crucial for drug release and interaction. The second one is kinetic stability. While they don't settle like suspension, their small size and often electrostatic repulsion prevent rapid aggregation. The third one is Tyndall effect. They scatter-like, which is why colloidal dispersion often appear turbid or cloudy.
So first up, hydrogels. These are 3D networks of hydrophilic polymers that can absorb large amount of water or vehicle fluid, swelling without dissolving. The second, preparation. Hydrogels are typically prepared by cross-linking hydrophilic monomers or polymers. This cross-linking can be chemical, using covalent bonds, or physical, involving interaction like hydrogen bonding or ionic forge. And the last, colloidal aspect. While not particle in the traditional sense, the swollen, hydrated polymers network of a hydrogel can be considered a colloidal dispersion of the polymers within aqueous medium. Individual polymers change, and their interaction with water create a system where the dispersed phase polymer network is intricately mixed with the continuous phase water, exhibiting colloidal properties like high surface area and control diffusion.
Okay, I will explain about definition of microparticles. A microparticle is a small particle that is between 1 and 1000 micrometers in size. Microparticles are usually used to carry and protect active substance such as drug so that they can work better in the body. For example, microparticle can help drugs be released slowly or only released in certain places, such as in the intestines or cancer cells. There are too many types. The first one is microspheres. The entire particle contains the drug or solid, and two, microcapsule. The drug in the core surrounded by a protective layer or cell. And then application of microparticle in pharmacy. Microparticles have many use in the world of medicine. The first one, control release the drug, release slowly so the effect lasts longer. And then target delivery, the drug is direct to a specific part of the body such as tumor. And the vaccine delivery, microparticles can carry antigens to stimulate the body immunity. And the last one, proteins, peptides. Microparticle protect drug from being quickly destroyed by the body enzyme.
Now, after knowing the definition or the meaning of microparticles and the properties of microparticles, let's discuss how microparticles work in drug delivery system. First, microparticles help with the controlled release. What does it mean? It means the microparticles will or the drug will not be released all at once inside the body, but it will be released slowly. So patients who need medications or kind of medicines that must have continuously released, okay, or long time release, we can help them with designing the capsules or the tablets of the medications with microparticles, which will allow the drug to be released slowly throughout the body. So instead of the patient taking the drug every period of time, every some hours or every day, maybe he can take it only once a day, maybe once a week, it depends. But let us know how these microparticles work in controlling the release of the drug. Here, there are some ways or few ways. The rest of them is the diffusion controlled. Diffusion controlled means because or due to the difference of concentration, okay, inside the drug and outside the drug, which is in the body, diffusion will happen. So the drug will be moving from the capsule or the tablet out to the body, but so this process will take time. So it will not be all at once. No, the movement will be slowly released from the inside of the drug outside of the drug, which is the body. Another way is the erosion controlled. This means the microparticles, the particles itself, will be broken down. Okay, so will be broken down over time. Over time, it will we can say breaking down of these particles will happen over time. It will take also time. So because the particles which is enclose the capsule or the tablet or enclose the active compound will be broken down, so it will allow the drug to release. The third way is the osmotic release. What does it mean by osmotic release? It means that the drug has permeable membrane. Permeable membrane means that the water will get into the drug, get into our capsule or our tablet. So after this drug is full of water, the particles will push out the drug. Why? Because there is kind of a pressure will occur inside the drug. So then the drug will be released or pushed out from the tablet or from the capsule. And this also will take a period of time. So will allow the drug or the active compound to be released slowly inside the body. So here we can say that the microparticles will make or help us to design controlled release drugs, also sustained release drugs, because maybe when the drug is sustained release, continuously released, so the patient doesn't need to take the medicine every several hours or every period of time, because the drug will be released in his body continuously. And other thing about the microparticles is that they can be targeted. This means we can design them to deliver the drugs directly to specific parts of the body. So these microparticles will not interact with any kind of cell. It will interact only with specific types of cells. For example, here the tumor cells. So this will help us to just use the drug or to just target and send our active compound, our medication, to the right site, to the where it's needed. And there are many applications of microparticles in pharmaceutical field. For example, here we said that the microparticles help to control the release of the medication. Regarding to this, we can give example of the PLGA. PLGA is the polylactic glycolic acid. This class of medication is used to control the glucose level in the body. So here, the insulin hormone will be encapsulated with the microparticles. So the drug or the insulin will be released over time. It will be released over time through the body. It will not be released all at once, so it will reduce the number of injections that the patient needs. So instead of taking many injections in a day, he can just take this medicine, and this medicine will work over long time to control the sugar in his blood. So the level of insulin in his blood will be stable because it's released over a long time continuously. Another example for the targeted cells, for example here in cancer treatment. So chemotherapy drugs usually affect the healthy tissues or healthy cells. So if we have a medicine and this medicine like goes to work in a healthy cell, it would damage the cell. So avoiding that, we can encapsulate also this kind of medications with microparticles. Microparticles will carry this drug only to the harmed or only to the tumor cells. So it will protect the healthy tissues of the body and it will treat our targeted cells, which is the tumor cells. Also, we can there are different also or other applications of the microparticles. For example, in drug solubility, some drugs, for example, here the graciofulvine. The graciofulvine is used for the fungal infections. This drug cannot dissolve in water easily because it has it has, we can say, narrow area or surface area, small surface area. So when it's encapsulated or when it's mixed with microparticles, the microparticles will give it larger surface area, so it will make this medication more dissolvable. It will dissolve better and fast with the with water, so the effectivity of the drug will be faster and it will not be affected. Another example is also for using microparticles for the protecting sensitive drugs. For example, the insulin, other also vaccines. This kind of medications are so sensitive to the acidic environment. So if these medications reach the stomach, and the stomach, as we know, is so acidic, it will be degraded. Okay, because the acidic or the high pH level will affect these medications. It will break down these medications. So when these medications are encapsulated with microparticles, so it will not be absorbed, it will not be broken down in the stomach, but it will be absorbed in the intestine, where it can be absorbed more effectively.
Let's talk about emulsions and microemulsions. An emulsion is a dispersion of two immiscible liquids, like oil and water, stabilized by an emulsifying agent, what we call surfactant, like twin 80. Preparation of emulsions. Emulsions are typically prepared by mechanical agitation, high-speed mixers, homogeneous sonication, to break one liquid into tiny droplets within the other. An emulsifier then adsorbs at the oil-water interface, reducing interfacial tension and preventing droplet coalescence, becoming into big or mass droplets. Preparation of microemulsions. Microemulsions are dynamically stable, optically transparent, isotropic mixtures of oil, water, and surfactant, often with a co-surfactant. They form spontaneously upon mixing the components in specific ratios without significant mechanical energy input. Let's continue. So to be more detailed, microemulsions are excellent candidates as potential drug delivery systems because of their improved drug solubilization, long shelf life, and ease of preparation and administration. Three distinct microemulsions, oil external, water external, and middle phase, can be used for drug delivery depending upon the type of drug and the site of action. In contrast to microparticles, which demonstrate distinct differences between the outer shell and the core, microemulsion Microemulsions are usually formed with more or less homogeneous particles. Microemulsions are used for controlled release and targeted delivery of different pharmaceutical agents. For instance, microemulsions were used to derive oligonucleotide, small fragments of DNA, deoxynucleotide acid, specifically to ovarian cancer cells. In contrast to microemulsions, nanoemulsions consist in very fine oil in water dispersions, having droplet diameter smaller than 100 nanometers. Compared to microemulsions, they are in metastable state and their structure depend on the history of the system. Nanoemulsions are very fragile systems. The nanoemulsions can find an application in skin care due to their good sensorial properties like rapid penetration, merging textures, and that their biophysical properties, especially their hydrating power.
Next, we talk about the colloidal aspect of emulsion and microemulsion. Colloidal aspect of emulsion are classic colloidal system with liquid droplets dispersed in another immiscible liquid. The droplets are typically micrometer to submicrometer range, while the microemulsion have smaller droplets, often in the nanometer range, and making them through colloidal dispersion that are thermodynamically stable. The smaller droplets enlarge interfacial area enhance drug solubility, also absorption. Then application of emulsion are widely used for topical formulation, for example like cream and lotion. Also oral drug delivery for improving the bioavailability of lipophilic drug. While the application of microemulsion are increasingly explored improving the bioavailability and solubility of poorly water-soluble drug, particularly for oral, transdermal, and ocular delivery.
Next, we have liposomes. These are spherical physical composed of one or more phospholipid bilayer enclosing an aqueous core. The preparation common methods include thin film hydration followed by sonication or extrusion, reverse phase evaporation, and detergent dialysis. The choice of lipids, preparation method, and post-processing step determine the size, lamellarity, and stability of the liposomes. Then the colloidal aspect. Liposomes are excellent example of colloidal system. Their size typically ranges from tens of nanometers to several micrometers. The phospholipid bilayer structure allows them to encapsulate both hydrophilic drug in their aqueous core and hydrophobic drug within the lipid bilayer. The colloidal nature means they can circulate in the bloodstream, evade rapid clearance, and offer target delivery based on surface modifications or passive accumulation in distal tissue. For example, EPR effect in tumors. And application, liposomes are pioneers in nanomedicine. They protect and encapsulate drug from degradation, reduce toxicity by altering drug distribution, and enable target delivery. Famous examples include Doxil, liposomal doxorubicin for cancer, and Ambisome, liposomal amphotericin B for fungal infection.
Okay, so after we explored about liposome, let's now explore about micelles. Micelles are self-assembled colloidal aggregates of amphiphilic molecules, surfactant, or block copolymers in aqueous solution above a critical micelle concentration or CMC. And for the preparation, micelle forms spontaneously when the concentration of amphiphilic molecule exceeds their CMC. And for polymeric micelles, method often involve co-solvent evaporation, dialysis, or direct dissolution, allowing the hydrophobic blocks to aggregate in the aqueous environment. And for the colloidal aspect, Micelles are typically much smaller than liposome, usually 10 to 100 nanometer range. They are true colloidal system forming spontaneously due to hydrophobic effect, where the hydrophobic tails aggregate to form a cone sealed by the hydrophobic head facing the aqueous environment. This structure makes them ideal for solubilizing poorly water-soluble drug within their hydrophobic core. And for the application, the polymeric micelles are gaining significant attention for solubilizing hydrophobic drugs, improving their bioavailability and achieving target delivery. They can encapsulate drugs like paclitaxel or cyclosporin A. Their small size allows for extravasation into tumors or APR effect and sustained release. They are also explored for gain delivery.
After you already know about the previous material, we're going into the next material. In this question, we're going to talk about the nanoparticles colloidal system. So what it is, nanoparticles colloidal system is nanoscale particles that disperse within a medium forming a colloidal system. These particles typically ranging from 1 to 100 nanometers. At this scale, materials often have unique physical, chemical, and biological properties that different from their bulk form, of course. For example, these are the characterization of colloidal nanoparticles in mix with polydisper and multimodal size distribution. This is using particle tracking and electrospray scanning mobility, particular size. So there was very different size that you can see. Every bulk is very different size and also different form. And next into the graphical abstract, as you can see in here, in that size, it can be visible in human eyes. So nanoparticles is very small size that cannot see by human eyes or human visual. And next into the nanoparticles in the pharmaceutical and application. So are the application of nanoparticles in pharmaceutical. Colloid nanoparticles are increasingly utilized in pharmaceutical application as drug delivery system. So drug delivery system is the pharmaceutical application, one of the pharmaceutical application due to their unique properties and ability to enhance the therapeutic outcomes. These nanoparticles can be designed and escapulate drugs, protect from degradation, and deliver them to the specific target within the body. This lead increased efficacy, reduced toxicity, and improve patient complaints through target and control the drug release. And more detail about that is, for example, like target drug delivery. So target, we need the delivery target. So nanoparticle can be modified with targeting moieties like antibody or peptides to selective bind to disease. For example, like the nanoparticles is especially they have come to target one of our cell or tissue. Next one is controlled release. So nanoparticle can be engineered to release drug at a specific rate. For example, like either over response in certain stimuli, for example, like pH, an enzyme, it's allowing sustained localized drug delivery.